Hello, my name is Richard and Katie and I are occupational therapy students on placement on Ward C4. We have developed this video to provide an understanding of the theory and reasoning behind some of the activities and resources we are implementing on the ward. We hope this provides an overview of the activities and helps you to use them with the patients.
Within the context of occupational therapy, occupation is what is important to us and contributes to our identity as a person. Occupations are the everyday activities that we do, and those that bring meaning and purpose to our lives. These include what we need to do, what we want to do, and what we're expected to do. Being able to choose our occupations helps us to hold on to our own identity and sense of who we are. Volunteering could be considered one of the many occupations that make up you as a person.
In occupational therapy, we look at people as individuals and their ability to engage with those everyday activities. We want to work with a person's strengths and what they can do rather than focusing on limitations. This allows us to concentrate on what activities are truly meaningful to them. Occupational therapy also considers the environment and how this affects a person being able to do the activities that matter to them. Considering a hospital ward environment, the pressure of acute care can lead to stress and anxiety for people with dementia. There is also the risk of loss of previous abilities and increased levels of dependence. In this environment, additional support may be needed to help the patient engage with the activities that they want to do.
While in hospital, patients aren't able to do their normal day-to-day activities, such as going to the shop for the paper or making themselves a cup of tea. This might not seem too significant in your own context, but for people with dementia, this lack of activity and routine can have a huge impact on their independence and health and well-being.
Doing an activity with a patient helps to focus them and stimulate them in a number of different ways. Activities can help to maintain a person's well-being, improve their quality of life and self-esteem. Activities can enable a person to express themselves, which can prevent frustration, boredom and distressed behaviours, as well as increasing social contact and family networks.
Cognitive Stimulation Therapy is a treatment program that uses activity to stimulate and engage people with dementia in a positive learning environment. We have been using the principles of cognitive stimulation therapy to adapt and design easy-to-use activities and resources. These can be used to support meaningful interactions with patients based on their interests.
Considering an existing activity, a jigsaw is a great way to maintain some of these physical and cognitive skills. It requires the person to organise the jigsaw pieces in an appropriate way, to use reasoning to fit the correct pieces together, and fine motor skills to use their fingers to assemble the pieces. A jigsaw can also act as a conversation tool to speak to the person about a topic they may not have thought about otherwise. Most of all, a jigsaw is a fun activity to do with someone, but this gives an idea of the other ways that it can help a patient.
We've been developing a wide range of resources to help individuals engage in meaningful activity. Considering the high turnover in the ward and the varying interests of individual patients, our aim was to create resources that could be adapted to suit each patient. To support these, we've also developed activity guides to give further information on how they can be used and why they matter. When working with people with dementia, using activity can help to anchor a conversation. Activity, as well as photos, can help to unlock the words and memories that might have otherwise been missed or lost. Even if the person can't recall the activity later that day or week, the positive feelings of doing a meaningful activity remains with them. This is an overall benefit to their health and well-being. Thank you for taking the time to watch our presentation. We would encourage you to carry on this conversation amongst yourselves. Share your thoughts, ideas, challenge yourselves, and help each other learn how you can best use activities within your role.